All right. Good morning. Good afternoon, everyone. My name is Lisa Stepenko, and I'm the CEO of Consilium Scientific. So today we're welcoming Professor Bennett, who is currently at the University of South Carolina, and he's here to share an incredible story of his journey, of his academic journey, of his professional journey as a clinician. Dr. Bennett, please, the floor is yours, and do share your slides.
Thank you so much. This is going to be a review of a book that's written about me, but not by me. So I'm going to be literal, and I'm going to go through the book as it's written, not without any personal modification. It is therefore not my book. I mean, not my story. It is Dr. Professor Jack Julius Getman and Terry Clark, PhD's story. And as you can see from the cover here, it says "Taking on Big Pharma, Dr. Charles Bennett's Battle." It's a nice follow-up to last time's conference that we had with Kim Witzig, which she talked about her work with the FDA, particularly related to the work that she's done as an FDA advisor and on the antidepressants. And as you can see in the quote, if you can't see the slides, the quote at the top says, "Charlie Bennett saved more lives than anyone in American medicine." And that's from Steve Rosen, City of Hope National Cancer Center, and my former boss. And as we start the book, there's a prologue before chapter 1. The prologue just makes the point that the reason why this book got written in the first place is I happened to be on a cruise with Jack and Terry, and I had all my information about my life with me on the cruise. So if anybody ever wants to get a book written about them, the best thing I can advise them is go on a cruise and carry your life story with you in a bunch of manila envelope kind of stuff that I did. And poor Jack on the cruise, who was 87 at the time, he was stuck with 8 days with me on the boat. And I had a chance to convince him to potentially write the book. And so this whole thing we're going to talk about today is based on a cruise, a story. Then I've done that. The first chapter Jack wrote about the book is talking about my life when I started my work in adverse drug reactions. And I am pharmacovigilance, a pharmaceutical watchdog. That's what I do. And I initially started my work in AIDS and HIV. I see in the phone Brian Edlin, who was at the CDC at that time, and we did a lot of work in HIV collaboratively. And we looked at that time with pneumocystis carinii pneumonia, which is disease now changed to PJP, and it's a thing of the past. I've built an international drug research group to do my work. And the thing that I learned in my work was you're never going to get NIH funding unless you come up with an acronym. So I spent most of my time, rather than writing my grant, getting my acronym, which I call Research on Adverse Drug Events and Reports, which is called RADAR. And I was an associate professor at Northwestern University School of Medicine when I was a RADAR person. And so there I did my original work in RADAR, and my work in the first 10 years or so resulted in about 50 publications of serious adverse events. About half of them were black box warnings. And the things that we looked at within RADAR was initially Ticlid, which was a big anti-platelet agent. And my group, RADAR, we were able to show that 1 in 2,000 people who took Ticlid developed a blood side effect called TTP, thrombotic thrombocytopenic purpura. And they developed it within 2 to 4 weeks after getting the drug. And we also showed it was related to an antibody that showed up and led to the whole side effect. And because of that, we also showed that you could treat it and cure it if you used the plasmapheresis and you took off the antibody. So that was a major, major change because it's a major drug. And so we moved on from there and we published that. And then we moved next to EPO. And those of you who want to know what EPO is, some of you do know, some of you may not know. EPO is the drug that is used to raise your red cells. And so the drug that was used to raise your red cells is also used by Lance Armstrong when he won the Tour de France 7 times in a row. What he did with the Tour de France, is he was able to use EPO, and when he used that in EPO, he was able to increase his red cells, which helps him a lot. And he was able to win the Tour de France 7 times in a row. But the biggest point about EPO is not that it helps you win the Tour de France, because it's not a big market for people who want to win the Tour de France. But there is a big market for people that are anemic, which is where EPO was positioned to be. And anemic patients occurred broadly in 2 settings. One setting is dialysis. Dialysis patients are often anemic. In EPO, it turns out that before EPO, dialysis patients used to spend 3 days a week in a chair and getting transfused. The second kind of patients, which was the second market for EPO, was that cancer patients who received chemotherapy also got anemic, and EPO was used for that. And a third kind of patient that came up, which was really out of the box a little bit, was that EPO was used for people with cancer who didn't get chemotherapy, who still were anemic. And so they decided, the companies this time include 3 large companies: Amgen out of Thousand Oaks, California, Roche out of New Jersey, and Johnson & Johnson out of New Jersey. Roche, I'm sorry, is out of Switzerland. And so Swiss company. And those 3 companies collaboratively would make about, maybe over a course of a year, they might make, they could make 10, 12, 13, $14 billion. B with a billion. And so I developed a project myself where I collaborated with a German clinical researcher who did a phase 3 clinical trial, which is a one-site, single-site study. I mean, it's a 320 patient study. And the study included patients with head and neck cancer. Half of them received EPO and half did not receive EPO. And then what happened with that is, then at the end of this, the hypothesis was that if you used EPO aggressively, you could get more blood flow to the cancer site itself. And if you radiated the patient with cancer and got more blood flow to the radiation site, you get more kill and patients would live longer. So instead of suggesting that EPO was working by making people less anemic, it was that it would make the cancer go away faster. This was a novel hypothesis. And my collaborator, Michael Henke in Germany, was excited to do this with funding from Roche Pharmaceutical at the time. Unbeknownst to him, or unexpectedly to him, when the study was complete, the people in the EPO arm versus the ones in the placebo arm died 25% more often. A shock. This was supposed to make life better for these people. It became worse. And as a result, they died more often, which was completely unexpected. And then I worked with my collaborators and we found another trial just like that. It was another study on breast cancer with the same hypothesis of more EPO would increase more death. And again, the wrong thing happened. And finally, there was a third trial on lung cancer in Canada, a small trial. And again, with more EPO in the lung cancer patients, bad things happened. Given all that, we went on to do a meta-analysis. And on that meta-analysis, we found with 51 studies and 13,000 patients that in fact, when you put the data all together, it's a 10% higher mortality rate. And when we put that mortality rate data together, we also went to the FDA to explain what we found. The FDA had an advisory hearing, and the FDA was considering removing this $10 billion drug from the market. And as this all happened, the drug sales of the drug plummeted from $10 billion down to 500,000. One of the biggest drops ever in the history of a pharmaceutical company. And it's not one that's going to make me a lot of friends if you think about it. But the cancer letter, which is our major letter goes to all cancer centers in the country, it responded and looked at my work and says, that I found that we have a safety signal on deep vein thrombosis, blood clots, and we now have one for survival. How much more do we need to show you to stop overusing these drugs? How many safety signals do we need if we get the idea that we have to reconsider what we are doing here? You can imagine that did not go over very well. And then when Paul Goldberg, the writer of that, asked me to clarify it next week after my presentation, I changed my idea. I said my findings weren't newsworthy and that the drugs posed no previously undisclosed risk of death to 90% of people. And he responded, quote, "What the F, Charlie?" He was upset. And the whole point of him being upset is I had changed my mind because that my story had not been peer reviewed. It was under review at JAMA. And I wanted to wait till I got it to JAMA before I made such a strong statement. New York Times, they thought my findings were outstanding. They had a whole page running on it. They thought that it was going to be changing and transformative. And I got widespread acclaim. But as you know, no good story stays. So after I did some talks about this work and all this stuff, I went back to Northwestern, came back on the plane, and immediately when I got back, I found that the university was investigating me, and they were questioning whether I'd used my grants to fund the work against Amgen. What kind of question is that? Have I used my work to help save hundreds of thousands of grants? And the work was used to hire students. I had a website that was built at that time by one of my cousins, which was cleared by the university. I had a brother of mine do the photography. I had grants. I paid ATS data. I had another website developer who was a member of one of the most famous families in the country work on the project. And we had all these things, and they decided that they didn't like any of these people working on the project. Their request was, why did you have anybody working on this project? Couldn't you do it all yourself? And so the interesting part was, as soon as they raised the question, my administrator, who was working for me and was hired by the university just 2 or 3 weeks before we'd heard about her, she went and she found, she had a bunch of PowerPoint presentations. She sent emails and called all my collaborators at home at night. She asked if they were qualified individuals. Could they do work? Were they actually able to read and write? Very, very disrespectful. And then what she did was she would come to my office and help me fill out the time and effort for all my employees. And as we did time and effort, she did most of the recording and I signed. She made sure that everybody's time and effort was attached to the wrong grants, since I didn't know the grant numbers. And then after all that data were entered, most of it that she helped me with was on the wrong numbers. She went and she got a lawyer, and she went to the Department of Justice and filed a whistleblower lawsuit and say that I had misused my grant money. For instance, she said and accused me of putting down the wrong grant numbers for my employees. Well, of course I put the wrong grant numbers for my employees because she's the one who put them down. And that's how she knew they were wrong, because she put them in. And then they decided that they were going to figure out the best solution. The university said, why don't we just lock your door, get you off the campus, and no longer let you look in a lab, and just live life as it is, and don't work on the project anymore, and we can take the project over and assume the project and the money. And they said, good luck. So given that, I worked aggressively with my lawyer. My lawyer was a great lawyer the Northwestern University found for me. And my lawyer was helping me on my case like crazy to try to make sure that this thing didn't get out of hand. And my lawyer developed a joint defense agreement. I don't know if y'all know what a joint defense agreement is, but it's the kind of joint defense agreement that's seen now in for instance, Donald Trump's case. There are a lot of lawyers that are joint defense agreements in Donald Trump's case. My joint defense agreement included a lawyer who was, in fact, a lawyer for Amgen. And so as I worked with the university supplied lawyer and gave him all the material that I had about Amgen, he sent it right to his collaborative attorney who sent it straight to Amgen. And why was it relevant? The Department of Justice decided to file a $1 billion lawsuit against Amgen for marketing a drug because it's unsafe, because Bennett's data said it was unsafe. And the Department of Justice asked Bennett if he would be the lead witness in the case, if he would be the lead witness in the case against Amgen through a grand jury out on the West Coast. And Bennett asked the U.S. attorney, what is the chances that Bennett will not get killed in the process of being the lead witness? And the U.S. attorney replied, we haven't lost a witness yet. Made me feel really good. After that, the FDA got investigated like crazy with us. And they really were, they were going to be not diverted. They took this investigation. They have the whistleblower complaint. And then the Department of Justice decided to join that complaint. And they said that their goal was to put Charlie Bennett in jail for using the grant money to find adverse events on a drug that should not have been evaluated with that grant support. And the U.S. attorney said, look, let me be honest. There's 4 people we've ever gone after in Illinois. The first one is Rod Blagojevich, the governor. The second one, he said, is Scooter Libby. For those of you who remember the CIA and Scooter Libby. The third one is Jesse Jackson Jr., the congressman who's the son of Jesse Jackson. And the fourth one was Charlie Bennett. He said he would not rest until all 4 are in jail. And 3 of the 4 ended up in jail. And 2 of those 3 were pardoned by Donald Trump. Scooter Libby was pardoned by Trump. And so was Rod Blagojevich, who got 7 years off his sentence muted. So I moved, not easily, to the pharmacy school at the University of South Carolina. As I interviewed for jobs all over the country, every time I went to an interview, there would be somebody from Northwestern calling up the dean of that school that I interviewed at and saying, listen, there's a lot of things happening, but one thing you should do is never hire Bennett. Now, the issues about me in the lawsuit were under seal. So as I looked for a job in 2009, neither me nor anyone at the university nor anybody besides the Department of Justice knew if there were any real allegations against me or anybody else at Northwestern. But even though they were under sale, the university would call up all my prospective employers. I was able to get a job at the School of Pharmacy with an endowed chair in South Carolina because the med school people don't know pharmacy school people. So I was able to outrun them. And when I got down to the South Carolina School of Pharmacy and my $6 million NIH grants that I had down there, the university did a clever thing. They decided not to transfer any of my 20 years of grants to me. And they decided to let my grants be transferred to a bunch of people who've never done any research before. And they spent out the last $10 million of my research without no productivity. So one of the things I would raise, it's a concern that Jack has raised, is that grants are paid to do work. And for them to transfer the grants and do no work and accept the money is probably not legal. But beyond that, I had the FBI under investigation. I had 11 federal agencies investigating me at this time. I was friends told me I was on a list of the FBI most watched list at this time. But I moved, started my own research again, and I developed what's the most important thing, as I told you about research, is a new acronym, Southern Network of Adverse Reactions, SONAR. So here I come to South Carolina, where I am now, as mentioned in the introduction. I have become the director of Smart State Chair and Endowed Center on Medication Safety and Efficacy. And I get international and South Carolina researchers who help me do my research. So then we go on to the investigation. And the FBI decides that they were going to try to see what they could do to take me down. So the first thing they did was they used the whistleblower. She was in 2009, and she was an administrative clerk. She worked for me. She said that she reported me to the federal government because in the invoices that were submitted under my grant, Some of the actual charges were in even numbers and had 0 zeros at the end. She thought that was suspicious. She said one invoice to my collaborator, Benjamin Jovegovich, had a whiteout, and therefore the invoice appeared to have been copied and pasted, she said. Some related to Charlie's grants were ascribed too vague. There were some duplicate invoices. Some amounts were in even numbers. The chief executive of my first company for the internet, and it was had been requested, was a former colleague of mine, and I spent more money on the grants when the grants were about to end, a practice that everybody does. But beyond that, she went around the campus and used that as a PowerPoint to say, that's the reason why Charlie should be put in jail. And my Otis Browley, who was the head of the American Cancer Society, when he heard about this, he said Charlie would admit a fault of his is that he's sloppy. Sloppy in the sense that he's a big ideas person. He doesn't focus what money would consider a dart in the eyes, crossing T's. He's much more concerned with what could be accomplished. He trips around. The result of that is the buttons of his shirt are not aligned. Now, I don't know if that's a terrible, but that's the way they look at it. And another commenter said, Charlie's been sick of science, but he may have his fly open. So this is the kinds of things. And here's what the one blogger said. What happened at the end of all this is at the end of the day, they found that Charlie was Steve Rosen and Northwestern University. They felt in the opening of the seal in 2013 had failed to appropriately administer the grants, NIH grants. Now, they do make a point that administration of grants is a product of, and a job responsibility of the university. They make 50% off a grant for administration. There are also certain people in the grants world who administer grants administratively, and that was, in this case, Dr. Steve Rosen, the administrator of the grants. And they also make a point that Dr. Charles Bennett had no authority to sign for even a pencil and was not administrative and could not sign for a single administrative. They also make a point that Dr. Charles Bennett had an administrator named Faye Sangali, who they found had written checks to $86,000 to a fake company, and she used that money to pay for her wedding. Then he mentioned, well, the money was used to pay for her wedding. When she was interviewed, she said, I didn't know anything about it. She also said she did not even invite me to the wedding for the $86,000. So the renewal by Roy Poses, who's a healthcare blogger, he said, under the title, he says, Dr. Bennett found irregularities. I did find those irregularities. And Faye Sangalé, the administrator, she pled guilty. Nobody noticed. And he said, it's totally disproportionate. If Charlie actually submitted excess travel and stuff like that, he should have been slapped by Northwestern. And if he somehow got by Northwestern and staff and they authorized it, the government should have slapped Northwestern. That's much too loose. And maybe written for him a letter saying, no. Maybe making at most ask him to pay it back. But 2013, they decided they found Faye guilty of a criminal offense, and she was fined $86,000 and 1 day in court. So all that, Faye now, she is now returned, and she's a faculty member at the University of Illinois. For all that work that she did, where she stole that money for the wedding, she has been awarded by a PhD RN faculty work at the University of Illinois, which is where she stole the money from in the beginning. I guess there wasn't a very good background check. And they also, at that time, they interviewed my, 2009, my secretary. She said that Charlie had too many meals compared to other faculty members, and he also wanted a newspaper paid for. She thought that was bad. And she said also often when he went to professional meetings, he also shared the room with his wife, which is a violation of federal principles, according to the NIH, I guess. And that reimbursement, they felt that when we submitted receipts, if the wife took up half of the bed, then half of the bed room costs should have been reimbursed. So that's the way they sort of decided. At the same time, given all this craziness, Charlie Bennett, me, took on a new drug, which is called Schapiro and Levaquin. And we worked because we saw patients with this side effect. And we found again, that was sonar. We found that there was thousands of people who took Schapiro and Levaquin. And when they took Schapiro and Levaquin, some committed suicide, very small number, and many more had 10 years or more of adverse events. And so we called this new agenda floxing, and we reported that to the FDA. So in 2014, Northwestern settles the case. I'm out of university now by 4 years. And when they settled the case, they said they would cover the university itself for the 2.9 million and Dr. Steve Rosen. And Dr. Charlie Bennett will have to find his own way of paying his own fare. It was very unique. It was the first time in the history of the government, of the NIH, that the university did not cover, especially non-administrative employees. But be it as it may, we were pleasantly happy to send $475,000. That's 3.5 times Michael Cohen's money to the NIH to settle the case. And at the same time, the Northwestern referred the case on, and the Department of Medical Licensing in Illinois came down to South Carolina and said they would remove my medical license because we paid that. We were able to negotiate with the medical licensing board that he said if we could pay him $50,000 in a one-day settlement time, he would just put a reprimand on my license. So thankfully enough, when the guy shook me down for $50,000, I gave him the 50, and I got a reprimand on my license for the settling the original case against Northwestern, which to me still remains unclear what part of patient care that has to do. Beyond that, Northwestern filed a complaint with the NIH in my new R01, and they said that they didn't think I was administering that grant very well. And we got audited 3 times in an 18-month period, each time losing the grant for 6 months, based on the complaints from Northwestern University that they thought the grants in South Carolina were not being appropriately administered. We passed all 3 times, but each time we were audited, they had to spend 6 months to remove me from the grants while they had a different PI hold the grant up until we finished the audits. Here's the message from Northwestern University. And if you can see the book here, let me see how it goes like that. Taking on Big Pharma. That's the book that I'm reading from. Dr. Charles Bennett's Battle. It's on Simon & Schuster. Dr. Jack Getman wrote it, and hopefully you all buy the book. But here's what Dr. Martin, the president of the university, the provost and the dean on August 2nd, 2013 say, Northwestern University entered into a settled agreement with the US DOJ and the HHS and litigation over expenditure of grants overseen by Dr. Charles Bennett, a former Northwestern faculty who was PI in the grants. The settlement involved no findings or omissions of wrongful conduct by Northwestern or any of its current faculty members or employees. It's careful to say that Faye, they don't talk about, she was in jail, so she could not be a current faculty member or employee because they didn't continue her work while she was in jail. And they say here clearly the grants overseen by Dr. Charles Bennett. They fail to mention that no NIH investigator oversees any grants in terms of actual administrative oversight. That is not the work of a principal investigator. That's the work of the university. So they have absolved the university from the work that they did, which was a failure to oversee the grants, and they have placed it on a scientific investigator who is not a grants administrator. As we made clear previously, this note that I'm reading you today, August 2nd, 2013, is still on the internet today. If you go on the internet today under Google, you pick up Schapiro, that's his name, Schapiro, and you pick up Bennett, and you pick up Northwestern and lawsuit 2013, this comes up. This comes up today, 11 years later. And then we made clear previously, Northwestern was nonetheless disappointed to see the allegations. Northwestern takes its grants administrative responsibilities seriously. And that's to make it so serious that 2 years before they settled this grant, they had paid $5 million for failing to administer grants previously. So they take it seriously even when they're recidivists. So on an agreement, Northwestern pays $2.9 million. And they sign it, the president, the provost, and the dean. So if you have those three signatures today, now this notification on the internet today is written 1 day after the U.S. attorney said that the fault of the administration was related to the person who was administratively in charge, Dr. Stephen Rosen. So although that's not mentioned here, that person was fired after the result of this, but they didn't mention that either because he was no longer employed there. So the Crane's magazine, as I say, shows that Dr. Stephen Rosen was the researcher. He was administrative. He was named in the original complaint. Dr. Bennett, Crane says, used federal grant money for family trips, consulting fees for my brother, my cousin to do the website, and the government alleges so. And they say, Dr. Rosen, this is important, quote, failed to exercise appropriate responsibility, said Randall Sanborn, a spokesman for the U.S. Attorney's Office. It was a supervisory function they didn't adequately fulfill. So the U.S. Attorney, 1 day before the Northwestern president tells you who did it, the U.S. Attorney tells you who did it, and they're different people. Now, the U.S. Attorney is usually more likely to be correct than not when it's talking about what the Department of Justice found, because it's a U.S. Attorney's job. So at the end of the day, I moved on to thalidomide because I just continued working on adverse events. And thalidomide was a drug that you all know was the reason why the FDA was reorganized. And it went from medical disaster to wonder drug. In 2017, I was the only scientist in the world, in the country, to identify serious blood clots with thalidomide. And in 2005, Senator Richard Blumenthal, who was then Attorney General, and I filed a citizen petition saying that the side effect profile for thalidomide was understated and misstated on the drug. 2006, and the first ever successful citizen petition from an attorney general joining to a researcher, we won the petition. Now in 2017, a whistleblower for Celgene said, despite that petition, the company was still marketing aggressively the drug without telling anybody about the side effect. And I was a witness again at this time for the lawsuit against Celgene's marketing technique. I went to the courtroom and said that they were doing something that we asked them not to do in 2005. So anyhow, we in 2017, that lawsuit, whistleblower lawsuit, settled for $280 million, which is the second largest settlement in the history of the United States for any drug against a drug company, based on a marketing, and did not have the Department of Justice. And I know about whistleblower lawsuits. I was there. And just to be clear, how great institutions, Jack writes, we include an in-depth look at Big Pharma's efforts to divert academia. And what Jack does in the book is he goes through similar stories for 20 other people that are like my story. But what's unique to my story is no academic has ever been investigated to the level I was by the Department of Justice. And secondly, no academic has been involved with the end of the day where the academic is left to pay the fine that somebody at the university should have paid, the one who was responsible. And so thirdly, as we talk about this, that's unique, is the point is that the Department of Justice has now become the arbiter and the overseer of interactions between the university and a researcher. And there's some concern that the Department of Justice might be collaborative, in fact, with the pharmaceutical company. And the pharmaceutical company, through this whole investigation, has left millions or tens of emails that we were able to find when I was the agreeing to testify with the whistleblower, the lawsuit against Amgen. When I got the file from the U.S. Attorney's Office, all the emails we got from senior VPs in the file said they will work to no end to destroy Bennett's career. That was documented in the emails that we look. And so, as Jack says, we'll look at the price Charlie paid for protecting integrity research. And the price we paid was very simple, $475,000 lost the 20 years of research, lost my NIH grants, have a reprimand of my license, 3 NIH audits, and a transfer out of a medical school into a pharmacy school. And I've been prohibited from going to a pharmacy school, medical school for the last 16 years. And so where we are today, I've been off kicked off all the boards I've ever been on, all the commissions I've done. My NIH grants were suspended, as I said, 3 times. I've paid hundreds of thousands of dollars, more than Michael Cohen was paid. And I paid a price from Odyssey. But the thing we do here, and maybe people like Ian Tannick will comment as we get further, is that this talks about the importance and the price we must pay to maintain academic integrity. Academic integrity is critical to our mission. And as we know today, academic integrity is under fire at every Ivy League institution and every institution we see with the current uprising. And so we are very concerned that if we lose academic integrity, we will no longer have a university system. I've been the 6-year Department of Justice investigation. They had 13 federal agencies looking at me. Dr. Jack Gemman wrote the book. He could only find accounting errors. I paid the Illinois agency to not suspend my license. I paid more than $600,000 in legal fees. And as Jack says, that's a lot of punishment for someone whose case was dismissed or settled with no finding of guilt. And the appendix A, what Jack puts in the book, is a June 25th, 2013. That's 2 weeks before the Northwestern notice from the president that Sangalay pled guilty to violation of Title 18 U.S. Code 641. And she drew on a bank account in Northwestern, made payable to a fictitious company, and were parts of funds dispersed for my NIH grants. May 15, 2007 to June 17, 2008, she had 10 false invoices totaling $86,000. ATS data that the company that she made up did not exist, never existed, and did not work. She created as a fake vendor code, and she did that as a fake way to get paid. She rented a post office in Chicago to get the checks, and she did all that to negotiate the checks. And no later than June 29th, she actually collected $86,000 for the grants. And then about July 30th, she did all this work in violation of federal code. Appendix B shows that Northwestern in 2003 paid $5.5 million to settle the identical allegations for the exact claims of mismanagement. So this is not new to the university. The last time, the $5.5 million, they weren't able to find an investigator to pawn it off on. In my kind, they did. They did the same allegations about failure to complete the grant appropriate. And they illustrate the importance of the United States. The university should be able to use the federal research funds appropriately, said the Attorney General. And they had restitution at that time. They had a whistleblower at that time. The whistleblower was fired. And as a result of the settlements, this whistleblower got $970,000. And Melissa Tice, my whistleblower, she received $900,000 for her complaints against me. And the Justice Department, look how many departments are here. The National Institute of Health, Program and Integrity, Maryland, U.S. Department of Health and Human Services, Office of Inspector General in St. Paul, coordinated by the Office of Inspector General in Chicago, Illinois, handled by the Civil Division Department of Justice with the assistance of the U.S. Attorney's Office in Chicago. This is not a small case to them. And the NIH grants, they complained. This is the circular. The grantee, which is a university, is responsible for administering the money, not the grant, not the scientist. Dr. Bennett is an individual designated, but he can only direct the science of the grant. And this is all for the NIH directors. And this is what the university should do, which they didn't do. Amy McGurk, our U.S. attorney, he took my wife of it, and she said at the end of the day that the client with the Department of Health and Human Services was prepared to enter into the settlement, and the AUSA said that they would do that, would proceed with an administrative proceeding to debar Charlie for longer than 3 years. And that's the end of that story. So with that, I want to stop share and go to, let me see how I stop share. New share or stop share? I got to stop share. Okay.
Thank you so much, Dr. Bennett. An incredible and heartbreaking story. So I would appreciate it if those of you who want to ask questions turn on their cameras and raise their hands. And while we're waiting for questions, I have one clarification questions and two follow-up questions. So clarification question, was this just an unfortunate sequence of events that while the whole saga unfolded by, let's say, instituted by powerful players to bring you down, this whole situation with your secretary who got money for the wedding, it was just a bad coincidence, or do you think there might be a connection?
Where the connection is not necessarily because every administrator steals money. I can tell you that. That's why you should be watching them closely, and they get paid to do it. But what the bad idea was when the Amgen was able to hire that person who became the one who called my employees up. So she was a plant from Amgen because Amgen had said they were going to destroy me. The best way to destroy me was to put somebody in my university and then have them initiate a whistleblower lawsuit. So she only worked here 6 weeks before she filed the lawsuit. And she reviewed 20 years of my grants and claimed that she had seen problems with the grants for 20 years.
Okay.
That's not an unfortunate accident. That's a purposeful attempt.
Okay. So then the questions are, question number one, if you knew somehow that this story will happen, or you could watch your talk right now, right before everything happened, or maybe years before everything happened, is there anything you think you would have done differently to avoid half of it, to avoid all of it, or it was completely impossible? And the second question, what would you recommend to others who are either considering, who are going for this integrity and perhaps taking risks that you have taken?
Three good questions. First of all, what would I have done differently? Simple on that. The university was inappropriate in what they did with me. The legal term, and I've now been through law school after all the things that have happened to me, if you can imagine. So the legal term is called tortious interference. They prevented me from getting a job at another university. And there's a way to sue under tortious interference. But you can only sue within 2 years of time because of statute of limitations. Now, my case was not unsealed for 6 years. So I would have been able to predict a crystal ball 4 years before that to sue for tortious interference because I didn't know the case existed. So if I had to do it over again, I would have bought a crystal ball and I would have been able to sue them. Then I could have sued them for tortious interference. I think the protection is needed to have tortious interference, but I have figured a way, a workaround, just a novel workaround, just to let you know. The university continues ad hominem to prevent me from getting future jobs every 6 months or a year. And we get documentation currently every 6 months or a year that they have actively prevented me from moving to various positions. Well, that's called tortious interference. But it's also called no statute of limitations because it's happening today. So one of the things that I would tell anybody to do is if there's something that happens, do understand what the statute of limitations are and make those statute of limitations in your favor and file the tortious interference case, which I am doing. So that's one of the things to do. You have to protect your rights. If your rights are being abused, file a lawsuit against them for tortious interference. If you miss the statute of limitations, then have to go forward and try to see if you can hit them again. Because people who try to destroy your life don't just quit. They want that as a lifelong mission. That's the first thing you said, what you could do. For other people to know, two things. Some people have told me that their homeowner's policy would pay that $475,000 that I paid. And there's also a program that you can sign with the American Social University professors for $100 a year, which will pay your fine. So if you're out there, pay the $100 for insurance from American Social University professors. And two, make sure your homeowner policy will cover any fine that the university decides to place on you for settlement of something as crazy as this. And thirdly, realize that your own lawyer, if he's paid by the university, he is not your lawyer, he's their lawyer. And he will be working actively, although I'm not telling you that, but he'll be working against you, not with you.
Thank you. It seems like a very chicken egg situation. I can't imagine many academics being able to afford expensive American lawyers to protect themselves. However,
Let me answer you up there. That's another key thing is make sure you have rich parents when you're born. If you get a choice of who your parents are, try to pick a richer one versus a poorer one. Secondly, make sure when you have a house, since you're going to lose the house, make sure you got a very expensive house because you're going to give it to the government anyhow.
that's very American advice. I actually, one of the questions I also had while you were talking, why didn't you leave the US or why didn't you move to Europe or somewhere else to continue your career? Have you considered that?
I went to all these countries. I have friends in many countries. Maybe Ian can tell me, but I couldn't get into these countries because what was following me was too much for them to even hire me. And they
Right.
got through the internet, the note from the president. That president prevented me from getting a job anywhere in the world. Anywhere in the world. He's very creative about that.
Incredible that
Ask Ian. Would I have been able to get a job in Canada with my background here? Ian is on mute. He's on mute.
Ian, yes, feel free to offer any comments. Okay, no comment. There's a question for you in the chat. Can you talk a little bit more about the work that you've done on Flux on Schapiro, like exactly what were the findings, how deep you went, and what were the conclusions basically in terms of.
So the key to the Flux, Schapiro, and Levaquin is we work with patients now. So patients are key. You've got to bring patients into your safety work. And Linda Martin is one of my key patient collaborators, PhD, and she's been sick with fluoxetine-associated neuropsychiatric disability for 10 years. We don't have any epidemiologic insight that this occurs, but I filed a citizen petition again, the Flux, in 2014, claiming that despite no epidemiologic petition, the stories of patients are real and should be listened to. In 2015, they changed the information about that in 2018, put a black box warning on the drug based on our complaint. Now, the thing we did with Flux is because no matter how much we complained about putting a black box warning, which took 4 years, they would not do it in real time. And patients were upset because this black box warning was not there. So I filed a whistleblower lawsuit. I figured I'd know this whistleblower lawsuit thing. And I filed a whistleblower lawsuit against Johnson & Johnson, which is still going through the courts now. And we've asked them for $2 billion to be returned to the federal government because they failed to put the label on the product. And 6 years now in the federal court in New Jersey. So I know whistleblower lawsuits.
Any comments, any questions from anyone in the audience? I found it interesting, Charlie, that your book is called Taking on Big Pharma. And I guess your research work is exactly what has happened. But the book is about the whole ordeal with academia. And when it comes to whistleblowing or going against a particular company or finding side effects or finding other issues, I guess it's not even a question of who is easier to deal with. It looks like with people who want their way, and if you go against them, it's equally hard, regardless whether it's pharma, academia, or government.
Well, the government has a bigger stick. When they offered me 6 months in jail, I just had to figure out if I wanted that vacation. That was their offer, 6 months in jail. I would have been probably the only academic in the country sitting in jail for whatever it was. I couldn't even tell you, but that was their offer. They also offered me a lifetime removal from NIH research and a lifetime removal of my license, medical license. And the U.S. attorney said there was jobs open in Starbucks that would be really open for me after they destroyed me that way. But I'll tell you, here's the book. Here's the quote in the book. I love this suspenseful book. The evils of pharma, academia, and the government is a terrible trifecta. Lessons learned from the movie The Godfather are plentiful. When is the movie going to be made? I personally am enthusiastic about this. Signed Al Ruddy, co-producer of The Godfather. So we're currently working to get the movie made, to get the message out, because not everybody reads the book. But stay tuned when you go to the theater near you and you see Taking on Big Pharma. And we have 4 finalists to play me: Michael Keaton, Tim Robbins, Mark Ruffalo, or Stephen Lang from Avatar. So anybody who reads my book, you must vote on the internet for which of the 4 actors you want to play me, and only one of them. My personal favorite is Stephen Lang, because Stephen has just read The Audible. And Stephen's background is he is the lead in Avatar. He plays Colonel Courage. So I tell him that he's too blue in Avatar because they're all blue. But once he does my movie, our movie, he'll be visible and he'll get enough Academy Award. So stay tuned for that movie.
That will be your second visit to Consilium.
Yes.
We'll have the film presentation. So there's a question in the chat as well, whether you can point to any peer-reviewed papers on Schapiro, because nothing comes up on PubMed. Where should the information be found?
Oh yeah, the Schapiro should come up on PubMed because we put it there. So if you look under Bennett, it might be A. Bennett because my son Andrew's first author, and Bennett CL, and look at the expert opinion in drug safety, EODS. That'll be the paper. That's in 2016, and also the 2019, 2016 in the Journal of Community and Support of Oncology. We put together all the lab results and the clinical results, and it came out in 2016. It was actually submitted in 2015, before the FDA meeting, and published in 2016. Those 2 papers will get you up to speed.
So there are a few more questions in the chat, but I suggest people can contact you via your work email on your South Carolina University.
All right, just do like 2 more minutes since we got 2 minutes to go to one.
Yeah, which is publicly available. So, and my final question to you is, what is your current situation now in South Carolina? Do you feel free? Do you feel you can do the work? Is there anything standing on the way at the moment, or you're in a happy place?
Well, it's a great place in South Carolina. I've had my endowed chair. I gave up my endowed chair last year on purpose because I'm busy working the Flux case. And my lawyer said that we should end up with about $2 billion in that case, which I'll get $600 million for my role. But that role then will be giving that money to a lot of people with cyprotoxicity and levaquin toxicity, which we're doing. And we've offered starting to endow some chairs at universities around the country. So in 2 to 3 years, we expect to be fully endowing 2 or 3 or 4 chairs in pharmaceutical safety. And to get the money, we expect to come back from the government on this false claim lawsuit. The point is that the government, drug company cannot fail to tell patients about serious side effects such as chloroquine toxicity. And they will have to reimburse Medicare for that failure.
Thank you. So that's a positive development. So hopefully this all comes together and you have your win in the end. So thank you so much for all the work that you have done for the patients and for surviving all the personal attacks and getting through the hell that you got through. And kudos to you. And we're looking forward to the movie. So
thank you. Thank you so much.
Thank you, Charlie.
Bye-bye. Bye-bye.
All right. Have a good afternoon, everyone. We'll see you in 2 weeks. Bye-bye.
What's 2 weeks going to be? The talk.
In 2 weeks, we have a talk from actually Andrew Reynolds on cancer. So everything is on our website. So please do check the schedule.
Thank you.
Bye-bye.